Ladies and gentlemen, Josh Sanch here. Welcome back to another installment here on the Bodybuilding News Network. A very interesting conversation I've seen happening online is let's be real, guys. If you're training, if you're a bodybuilder, there are a lot of issues that can affect bodybuilders. But one of them that a lot of people don't really think about, and they don't really talk about, is possible lower back nerve damage and pinching of the nerves. And I noticed Phil Viz, a coach on in bodybuilding over on Instagram, he talked about it in depth. I think Chris Aceto just posted a video with RX Muscle talking about it. Maybe some other news outlets have talked about it. So I wanted to shed some light on it, especially following the most recent Mr. Olympia, where especially Iain Vallier was having some issues posing, and there was some conversation about whether or not the discrepancy in his ability to present his back shots was because of nerve damage or something else. And also, I noticed that there was a lot of conversation around Big Ramy's lower back and lat insertions and what exactly has happened since, the last decade of what's been going on with his lower back. So let's go ahead and dive into it, shall we? So I briefly covered on how getting a pinched nerve is really a very common issue and injury that bodybuilders can have, especially in the lower back when you're deadlifting, when you're carrying heavy weights to and from the weight rack, when you're squatting. I mean, if you're doing Olympic lifting, a lot of those multi-joint movements, it's going to potentially cause some lower back inflammation and possible some nerve damage. And that's really going to be affecting your ability to pose. So, I'm not a doctor, but if you do have something like this going on for yourself personally, I definitely recommend you seek some medical attention first. A doctor or a physical therapist, they could probably diagnose that issue and hopefully give a recommendation on some sort of treatment plan for you. Things like physical therapy would definitely be something to help strengthen the muscles in your lower back and improve possible your range of motion. But I mean, in severe circumstances, who knows? You could probably get some surgery to fix that issue. But it can be a very serious issue. In a joking manner, you think about some of the guys at the Olympia. I think 3 different classic physique pros coming into the Olympia had to use stretching methods to make themselves look taller. But if you are having that issue, you could definitely try to relieve some pressure in your lower back. And if you don't, you could possibly get a pinched nerve from something like that. So definitely consider taking care of your lower back in the near future, especially with the conversation going on right now of how it could be affecting your ability to train your lower back or possible atrophy of the lower back musculature. Totoro completely agrees. But, in conclusion, if you're a bodybuilder and you're experiencing lower back pain, definitely don't ignore it. Try to seek out, like I talked about, some medical attention, and hopefully you can get some sort of treatment plan to address those issues. But definitely remember that things like this are going to take a long time. When you think about you didn't build the physique in a day, so you're not going to be able to correct the deficiencies in one day. So, be realistic, be smart with your goals and your ability to recover from possible injuries. But that's it. I don't want to dig into it too much, but definitely let me know your thoughts on the lower back issue, the whole lower back conversation. Thanks for watching. Make sure you guys subscribe if you enjoy this style of content related to bodybuilding and fitness. My name's Josh Sanch, host here on the Bodybuilding News Network, and I'll see you in another one.